addiction doesn't discriminate. I had clients ranging from a software engineer who was making, six figures until a couple years ago, and then ended up having surgery, became very dependent on opiates and was homeless at that time, to people who were very involved, not necessarily in a willing way, with the cartels, right? That had a presence there, certainly. So I had a very wide range of clients, and it changed my life.
Hello, I am B. Reeves with New Waters Recovery in Raleigh, North Carolina. Welcome to our weekly podcast, Finding New Waters. Our goal in creating Finding New Waters is to provide a resource for families to help navigate the complexities of supporting a loved one struggling with substance use or mental health. When we find ourselves in crisis due to one of these issues, most people have no idea where to turn. We hope to shed some light onto what is often the darkest hour for many families. Thank you.
Thank you for joining us today for another episode of Finding New Waters podcast. My name is Justin McClendon. I'm the CEO of New Waters Recovery, and I'm joined by my colleague, B. Reeves, Director of Business Development with New Waters Recovery. And we're here today with our special guest, Dr. Sara Koenig. God, tried so hard to get that down beforehand. Dr. Sara Koenig, who is the owner, CEO, medical director, founder, there we go, of and also board certified addiction medicine physician with Triangle Wellness and Recovery here in Cary, North Carolina, right?
Yes.
All right. Well, thank you so much for joining us today.
Yeah, thank you for having me.
Absolutely. So maybe we'll start out. Do you want to tell us a little bit about just yourself and what got you in the field? And
Sure. So this is actually my second medical career.
Okay.
I think people are surprised to find that out. I was in academic medicine, running a transfusion service, overseeing, a series of diagnostic laboratories, so on and so forth. And this was in New Mexico. We moved to New Mexico. We were there for a while. And then I actually enrolled in an MBA program while I was there because I was already in some pretty senior leadership positions. And my accounting professor, of all people, said, you need to work for us. And I was like, what are you talking about? And so it turns out she was on the board of Albuquerque Healthcare for the Homeless.
Oh, wow.
And they were looking for a new chief medical officer. And so I explained that I'm not a primary care doctor. I'm not a radiologist, but I'm definitely not a primary care doctor. I do know how to use a stethoscope. I did, I had regular patient care and whatnot. But I decided to make the switch, right? And there was a lot of excitement, but humility, right, in that switch, especially since this was a fairly sizable organization. So we had primary care, we had psychiatric care, we had dentists, we had therapists, we had case management, harm reduction, everything.
Oh, wow. And
I knew that in order to really be effective as a leader, right, I needed to be engaged clinically. And at the time, only physicians were allowed to write for Suboxone. And they had a small program of, I think, less than 10 clients at the time. And I made that my mission, was to grow their Suboxone treatment program. And a year later, we were up to the maximum that we could have, which was 120.
Okay.
And working with these clients really, it was really life-changing. It was. It taught me a lot of things. It taught me that you can't do good addiction work without really understanding trauma. You can't do good addiction work without really having a firm grasp of psychiatry, right? Because there are so many co-occurring disorders. It showed me that addiction doesn't discriminate. I had clients ranging from a software engineer who was making, six figures until a couple years ago, and then ended up having surgery, became very dependent on opiates, and was homeless at that time, to people who were very involved, not necessarily in a willing way, with the cartels, right?
Wow.
That had a presence there, certainly. So I had a very wide range of clients, and it changed my life. So I decided that I wanted to actually move back to North Carolina with my family, get more training, and then try to open up a practice that in many ways really resembled healthcare for the homeless in that it was integrated, right? We could actually walk a client down the hall and say, hey, I want you to meet this person, right? Or if I have a question, I can find a therapist and say, hey, how did they present to you last time? What do you think they really need? What is it that they're not going to bring up in their visit with me, but that I should know, right?
Absolutely.
So came back here. I was part of the first class cohort of UNC's addiction medicine fellowship, got my board certification, and opened up my practice in 2019.
It's amazing.
Yeah, I opened it up like just before COVID.
How about that?
Great timing.
So how did that play out?
COVID turned out to be less of a barrier than insurance.
Okay.
I'll tell you that much.
I hear you.
But what I did see in COVID, and what I continue to see, post, I don't know if we can really call ourselves post-COVID, but post-COVID, is that anybody who was struggling with anything, whether it was, anxiety, depression, substance use, like everybody got worse.
It's true.
Like maybe not nobody. I'm sure there are some people who decided to, take advantage of COVID and being locked in to work on their health and wellness overall. But a lot of people started day drinking. Yep. So I think being able to help people, and one of the positive, I'll use air quotes, I don't know if they'll be in the camera, positive aspects of COVID is that I really do think that it brought mental health more to the front, right?
I agree.
We had a lot more articles talking about it in the newspapers. I think it decreased stigma somewhat. I mean, I still battle stigma. I battle stigma as hard, if not harder, than I'm working to help somebody stop drinking.
Sure.
Right.
Yeah.
What do you mean exactly?
So in addiction, right? It's never actually about the drug. It's about the behaviors surrounding the drug. And because a lot of these behaviors are, self-destructive, obviously, right? When we look at the criteria for substance use disorder, are they continuing to use even though it's impacting their time with family and friends, even though it may make them violate their own ethical codes, right? Are they continuing to use even when they know it's medically dangerous, right? So there's so much shame around this, right? That addiction happens in the shadows, right? And to have somebody come out of the shadows and to ask for help and then be willing to be helped, right? One of the things that they're battling is this self-imposed stigma, right? That they've internalized. We have this myth that addiction is about bad choices. And I tell my clients, I promise you, the reason why you're sitting on my couch, I do have a couch, and the reason why I'm in my chair is not because I made better choices than you. Right? Nobody could have looked at me in high school and said, oh, she's the one who's going to be the doctor. I promise you that was not, that was not what they would say. But, kind of going back to my philosophy with client care, helping them believe or understand that they are worth it, right? That they are not broken, right? That is such a huge part of my job, because honestly, it's them believing, okay, I can do this, right? And I'm not a bad person. And at the same time, that they're navigating their relationships with family and friends and other people's opinions of them, it's really an uphill battle, right? And so if you look at somebody who, let's say, we add on a history of childhood trauma, we now have somebody who's grown up with a profound sense of shame, right? They really believe that there's something about them that is irredeemable, that is broken. And that actually sets them up, along with other factors associated with childhood trauma, but it sets them up to be more susceptible, more vulnerable to developing a substance use disorder. Right. So in those cases, I'm battling shame kind of on two fronts here. And I think that there's still this corner of addiction treatment where, this kind of more old school approach, perhaps, where shame and kind of publicly calling somebody out is actually thought to be therapeutic. And it's really interesting to me, and it made me want to kind of dive into the literature more, because I'm very curious about this. And I think one of the things that's important to distinguish is, the feelings of shame versus guilt, right? So guilt is, I feel bad that I did this thing, whatever it is. I feel bad that I lied to my family. I feel bad that I didn't show up for my spouse when I know they really needed me to show up. I feel bad that I lost my driver's license. Now somebody else needs to drive me around. But guilt doesn't place value on who you are as a person, right? You can do things that are quote unquote bad, right? But it doesn't change who you are as a person. And so guilt sometimes can actually be really constructive, especially in the field of addiction, because guilt offers it offers the opportunity for repair, right? For, really kind of making amends, rebuilding relationships. When we talk about shame and somebody's belief that they are wrong, they're a bad person, regardless of how they got to be where they are, they believe that they're a bad person. How does that help you repair relationships with other people?
I remember early on learning or being told that guilt is, I made a mistake. Shame is, I am a mistake.
Perfect.
Yeah.
Yeah, that's exactly it. And so shame drives people into isolation, right? It drives them to more substance use or whatever their maladaptive coping mechanism is. And so I think that's why it's one of the most important and insidious aspects of addiction treatment that is really frequently overlooked. I mean, I would say that when we think about addiction treatment, what's really going to move the needle, right? What's really, really important, in my view, based on my experience, it's really a trauma-informed or trauma-centered care, right? Person-centered care, and addressing stigma and shame. I think those are absolutely the most important things that we can do. Medicine as it is treats people like widgets, right?
Yep.
Like on the Jetsons, right? And I don't know if you remember the
Oh yeah,
okay.
Absolutely.
Okay. So it treats people like widgets, and speaking as a member of the medical community, we tend to design systems, and certainly health insurance companies design systems that are not designed around the client, but they're designed around efficiency, or they're designed around cost savings, right? We're very, very, very short-sighted. But I think if you are going to do this work and you're really going to make a difference in people's lives, a difference, then in their families and their communities, you have to kind of turn this paradigm on its head, right? You have to realize that this other person in front of me, I need to respect their dignity. I need to respect who they are as individuals. They are the expert in their own life.
Absolutely.
And I think that we really make a bad habit of skipping over. Doctors are so good at telling people what to do,
Sure.
right?
Yeah.
I mean, my daughter doesn't do what I tell her to do all the time. Why should I expect my clients to? So, yeah, I think, this is a very long-winded way of saying that I opened up a practice in 2019 that that is most closely aligned with my own vision, my own philosophy. This is a reason why I don't work for someone else. I've done addiction work for other people, right? Like, I know what that's like. And being a business owner and I guess an entrepreneur is super stressful and exhausting, but there is literally nothing else that I want to do than what I get to do every day.
That's amazing.
Yeah. I mean, it's really a privilege.
And because we know each other, New Waters works with Triangle Wellness frequently, and, we could attest to that your clients are better as a result of your passion and the way that you do treatment. So that's huge.
A lot.
Yeah,
thank you.
It's huge.
It sounds like you were saying something a second ago about the stigma and the shame is, and we talk about this a lot. It's really, really hard to ask for help.
Yeah.
And that's such a release from shame. But then to continue to receive the help is a whole other matter, which is really the most important part of it, is to receive the help. And then that's when I remember when I first got sober and being so worried that somebody was going to see me pulling into a church parking lot to go into a meeting, and just, or going in to see my therapist. And, it was like, I went to treatment and surrendered, but yet it took me a long time to not be worried about being seen, basically doing things that would show that I am trying to get better, which is, when I think about it now and say it out loud, it sounds insane, because it was.
Yeah, no, it's really hard for people. And I would say some of the factors that make it the hardest oftentimes are their family and loved ones. So we really try, we invite people to bring their partners or their families in. I've done plenty of family visits in my office. There's a lot of misconceptions. So there's the stigma, right, on the ground level that we deal with. And then there are all these misconceptions about addiction and addiction treatment and what does that mean, right? And what the expectations are, right? And I think that then when there's a disconnect between the expectations and the actual course of healing, right? Now there's an opportunity for more conflict. It reinforces stigma. Somebody will say, I sent her to detox and now it's a week later and she's drinking, right? Like, she's just a drunk, and on top of that, let's add, a bad mother, a horrible daughter, right? Like all of these different roles that in particular, are kind of used against women in this field. It's, that conversation is, well, you know what, actually detox, which we don't even really call detox anymore, at least in the medical community, we call it medically supervised withdrawal. It doesn't actually change the brain, right? It doesn't reverse these adaptations that the brain has made, which is what drives the behavior of addiction, right? 28 days. There's nothing magical about 28 days unless you ask Blue Cross Blue Shield.
Exactly.
Right. So we've kind of, I think we do a disservice when we neglect the role of expectations and their family dynamics and where are they going home to at the end of the day. Because it's so important. And the fact is, addiction is a chronic condition, right? If I have a patient who, let's say they've been sober for a year and a half, and they come in and they're like, I took a hit off of my friend's vape yesterday, or I had half a bottle of wine or whatever, they think I'm going to fire them.
Right.
Right. Like, no, that's why I'm here. right? I'm on your team no matter what, whether you have a good day or you have a shitty day. That's okay, right? And I think that is just another way that we help people really rise above that shame and that stigma, and realize that they are worth it. They're worth it regardless of where they are on this road of healing, which, as we know, takes a lot of twists and turns and detours.
Yeah, it does. I mean, it's funny you bring that up about taking a hit off the vape or drinking a half bottle of wine, and this, for everybody, it's their path to recovery is different, and the winding road, and sometimes a U-turn, and all sorts of, nooks and crannies along the way. And I was at a meeting yesterday, and a woman had been sober for 13 years and was at a wedding and was in the bathroom, and there was somebody left half a glass of wine, and she just drank it, but told on herself, and then picked up a white chip and started over, and that was about 11 months ago. And I just what I've sort of heard you say into, and like there's no right or wrong way to do this, but I've heard it said, written, read it, that we're never cured of this thing. What we really have is a daily reprieve contingent on the maintenance of our spiritual condition. And so that all, for me, that doesn't just mean like, prayer and meditation. It also means exercise, which I haven't done much of lately, going to therapy when I'm in therapy, and sticking to this plan. And then when we don't stick to it, whatever our plan is, then we do end up being in these vulnerable moments and picking up. But the good news is, look, we don't shoot our wounded. You're on their team, but this is just it's a journey. It's the journey, not the destination, right?
Well, and I think that also speaks to, you were talking about the shame and things like that. I mean, if we think of, and the trauma, and I think these things keep people, they develop, they have to learn how to, function in the world and things like that. So, they hide, they disconnect, they reach for substances, things like that, in order to cope and function. But it becomes such a ingrained part of just, this is how I function, this is how I live, this is how I get by. I hide who I am from other people because they don't want to see who I am. And then I think that goes directly into what you're saying, right? Because recovery doesn't just happen in a moment, right?
Right.
We don't just go to a meeting or go to 28 days of treatment or something like that, and then all of a sudden, abracadabra, we're just fixed. Like it really is like continuing to stay in that uncomfortable space of being vulnerable, trying to practice this new version of who we want to be. And I guess the hope is, if we can stay there long enough, that we can find that maybe it's a different way and it's a more comfortable way of living life, then we hope that it starts to stick a little bit, I guess. Right?
Yeah. And what would it be like if we substituted the word wellness, a radical wellness for recovery? Right.
Yeah.
And that's, I kind of going back to something that you said about how, this is a chronic condition, and it is. And that person who, had the glass of wine, right, is going to come in and they're going to feel really bad about themselves. Right. And sometimes, depending on the group, depending on the peer group, going and picking up that white chip to them feels like they've thrown everything away.
Yep.
But they really haven't.
Exactly.
They
don't have to forget everything that they've learned and absorbed for 13 years just because they did that thing.
Yeah. So, I explain to clients, like, listen, your brain has had a lot of practice at drinking.
Yeah.
Right. It is really good at it. So what we're going to focus on is giving it an alternative and practicing that. Right. And, because of the way that the brain can adapt, neuroplasticity, we can really change these patterns, but that person will always have a vulnerability, right? And the vulnerability is actually largely genetically determined. It's about addiction is about 45 to 55, depending on what you read, percent genetic, right? So you can't change that any more than you can change the color of your eyes. And then we look at factors like childhood environment, age at first use, how many years. There are a lot of things that go into addiction, right? And not, kind of going back to this idea of like bad choices. Like, we all make bad choices. All of us do, right? And yet we oftentimes don't like turn that back against ourselves and says, oh, I'm a bad person. I'm a bad person because, like yet again, I ordered, a triple caffeinated venti, right? Instead of what I told myself, which is I'm going to meditate and drink decaf all the time.
Well, no, it's fun. I was thinking about this when we were talking as we were walking in, and on Sunday, I had done my thing, played golf, came home, and I had all this stuff to do, including a bunch of admin stuff for work. And I was not ready to do it. And I'd been doing this kind of cleanse diet thing. And I basically, had like a food relapse and just ate like 5 of these bars in one sitting that was supposed to eat, once every 3 hours. And I talked to this person about it after. And what I realized is that I basically, there was such a direct connection between me having a thing that I knew I should be doing and wasn't doing it, and my way of coping with it. My solution at that moment was to binge eat. Luckily it was on, very healthy stuff, but still, I knew exactly, and even though it wasn't an ideal thing to do, I still made the connection and was able to talk about it with somebody, where before I would just kind of, I did that, I just binge ate, did this thing, but I wouldn't really try to learn from it necessarily. But I guess the larger point is we find all sorts of different ways to cover up for shame and guilt. And, it's a disease of more also.
It is. I think that's really true. And I think it's also, it's a disease at its most fundamental. It's a disease of emotional dysregulation, right? That feeling of, that nervousness, that emotional distress, sadness, shame, anger, right? Like there is something with addiction where your brain almost becomes, it's like these maladaptive coping mechanisms become really sticky. They become really, really sticky. And it's hard to let go of them. And yet this is the same process, right? It's never about the drug. It's never about, is this marijuana? Is this heroin? Is this alcohol, right? It's never about that. It's about, does it take up all of the air in the room for you? Right? Like, does it take up all of your mental real estate? And, frankly, we all have things that we do that we probably are ambivalent about, like, maybe, it's been like, a year since I've done yoga. Maybe I should do that again, right? So I think kind of normalizing the desire to feel different than you feel at that moment, right, is really important. It's not looking for the escape that somehow makes you a bad person. We all struggle with this. Chocolate is my thing. And I'm a rage binger. So if I'm really angry, I promise you, I can go through, do you know how many pieces of raw cookie dough you can eat in a sitting? Because I do, right?
Yeah.
And you need more than one hand to count those.
It's so funny. We do all these things, whether it's food, drugs, alcohol, shopping, and none of it is good for us. It's all, and it's just this crazy irony. Like, let's do this thing to change the way we feel for instant gratification, but yet play the tape forward and it makes everything worse.
Yeah.
Well, we're really not good at long-term thinking.
Right.
Right. Like, that's just not, we're living a lot longer than we used to. Our brain, especially if it's particularly sensitive to distress. For example, if you grew up in you've got a high ACE score, you grew up in a traumatic household, your brain is actually going to develop in such a way as to really give the amygdala, which is the fear center of your brain, it's like you're pumping steroids into it while it's growing. So I think there are a number of ways that we all reach for what is going to help, what's going to make me feel better, right? We make these negative choices for ourselves. And at the same time, we only, we look at somebody who has a problem with alcohol as somehow not being a bad person or as bad of a person as somebody who has a problem with heroin.
Mm-hmm.
Right. But it's the same process.
Mm-hmm.
It's the same thing.
Mm-hmm.
And so I think, normalizing things is another way to reduce shame. Right.
Mm-hmm.
It's another way to really, have person-centered care where the emphasis is not on me as your doctor telling you should do this, you must do this. Why aren't you doing this that we talked about before? Right.
Mm-hmm.
It's more like, I'm here to help you. I can't do the work for you. But I can hold hope for you on those days when you feel hopeless.
Yeah.
Right. I can give you medication. I can give you skills. I can try to match you to treatment that's really going to be transformative for you. But ultimately, none of us are angels. Right. And people depend on this willpower. If they lapse, they're like, oh,
Yes.
they have no willpower. I have no willpower, right?
Right.
So it's not actually true, but your willpower at 100%, your 100% willpower is going to be different from day to day.
Yeah.
Mm-hmm.
Right. So because somebody lapsed and drank the half glass of champagne doesn't mean that this person doesn't have willpower or doesn't want to be sober.
Oh, yeah.
Right. Or that they've thrown everything away.
Yeah.
In fact, I would say that the greatest damage there is the emotional damage that's done. And being able to kind of recover from that, move forward. It can be really hard to pick up that white chip.
Yeah. Mm. She talked about that. And, I selfishly ask people, usually if I get the opportunity, who had some time and then they have a brief relapse, like, what were you doing? Or more importantly, what were you not doing? And it goes back to that maintenance of the spiritual condition. And that's also, whatever that looks like for you. But what I find usually is there was something very important, or sometimes it's not a huge thing, but something that person was doing every single day for years or however long. And then they stopped doing that one thing. And then that moment of weakness is there, that unguarded moment,
Mm-hmm.
Yeah, absolutely.
What, so we're talking about you said, and I agree with this, that during COVID, pretty much everybody got worse.
Yeah.
But the good thing is it brought so much up to the surface that was just kind of bubbling underneath.
Yeah.
And that people couldn't hide from anymore. And Justin, we get, I would say 20% of the calls we get, it's either the husband or the wife or the son or the parent. During COVID, he was working from home during, and it just went from there. Friends in my personal life, all sorts of people, but especially get on our calls we get for people who are looking for help. So often it was, and again, it's also an excuse for people, it was, and then it becomes, an actual thing that needs to be dealt with. But we do hear that all the time. And the good news is this was probably going to be the case for most of these people anyway, at some point.
Right. Yeah. Yeah. And I think that, the paradox is that, yes, everybody got worse, right? 99.9% of people got worse. And they're also more likely to seek treatment.
Right. Mm-hmm.
Right.
Yeah.
So I think that part of it is huge. And, that's not to say that we have a huge battle, right? We're fighting uphill when we're fighting against shame, we're fighting against stigma. But at least it's a little bit less steep after COVID, like incrementally.
Definitely.
And access too. Telehealth, for example, it was around, it was definitely starting to be used more in like the primary care setting and stuff like that. But I feel like, again, that's another positive, if anything positive came from COVID.
Absolutely.
Is accessibility through virtual, telehealth options is just widely accepted now, which is huge.
Yeah. And so we were unusual in that we were already doing telehealth prior to COVID. Most of our visits were in office, but we were doing telehealth. And it's interesting. I don't know enough about this, but just based on my own experience, it's interesting how telehealth versus in-office visits changed the dynamics.
Yeah.
Right. And I think it makes it more accessible.
Yep.
Because for some people, they just, they don't have the courage yet to walk through my doors.
Right.
Right. And And I respect that and I understand that.
Yeah.
But they'll hop on Zoom
Mm-hmm.
and I'll begin to get to know them there. We'll begin that like therapeutic relationship that is so important. And actually, the therapeutic alliance is the number one prognostic factor when you're looking at long-term recovery, right? And also I've gotten to meet so many people's pets.
That's
Lots
true.
of dogs and cats, and occasionally my bird will come into the picture if I've forgotten to put her back downstairs.
That's funny. It's very funny. But yeah, it's been, out of something that was so horrible, there has definitely been some positives for sure, right? Similar experiences, I was actually helping someone or had just helped someone open a PHP and IOP program at the time. And the same thing that happened, we just basically established it prior to COVID. And it was the same thing. It was like, okay, well, how do we do this now?
We're going to need to change our plans.
Yes. We have to pivot a little bit. But yeah, it was horrible. And also maybe there was some good stuff that happened as well.
Yeah. And I think from the practice perspective, right, you have this, on the one hand, you're very, very excited about being able to offer your services, right? And have more people be able to access your services.
Sure.
And then there's the other side, which is, oh my God, how do I deal with the practical matter of, of just being able to get this person into a visit, right? Or being able to get their visit covered, or, like my staff is growing. How do I handle this? There are all of these other complications and aspects,
absolutely,
of having your own business that are, kind of like a second full-time job.
Yeah. Right. Yeah. The joys of being a business owner, right? You get to do the work, and then you get to do the other work.
And then when you don't want to do the work, you eat 5 healthy bars to change the way you feel.
Yeah, absolutely. Yeah, wash that down with a milkshake.
Right, yeah, I did.
Yeah,
a healthy one, a healthy shake.
Healthy milkshake.
Yeah, it was quite a scene on Sunday.
Yeah.
Oh, my goodness.
Yeah. Oh, I'm not even going to pretend that there were really more than a couple pieces of cookie dough left after I opened up that package that night. It's so good.
I hear you.
It's so good.
Delicious.
Well, so we, a lot of people who listen are families who have kids who are kind of in, the early stage. It may be pre-contemplative. They're definitely contemplating. They're, it's not exclusively that, but what do you say to parents who are just kind of monitoring a kid, especially like a, high school kid who's sees them probably hanging out with people and starting to experiment and just, what do you say?
So a couple things. One is you need to have a good foundational relationship with your kid. Okay, maybe more than a couple things. That's the most important place to start. Right. And recognize that adolescence, teenagehood is this period of time where there's this kind of explosion of growth from a neurobiological perspective, but yet the part of the brain that is underdeveloped is the frontal cortex. Right. So teenagers are by nature incredibly impulsive. They don't necessarily, weigh the pros and cons of things. They've got about zero long-term thinking. So I think recognizing that, being able to talk to your kids, especially if there's a family history of addiction, right? Being able to say listen, you are probably at higher risk than, your friends, right? Or a few of your friends, right? You are uniquely at higher risk. You guys may all be doing the same thing, be, passing around the same joint, but 10 years from now, that could be a reason why you're struggling with addiction. So I think that's key. And that, again, comes back to shame, right? Parents need to be able to really be honest in an age-appropriate way with their kids. The other thing is that I take a harm reduction approach, right? So, if they can wait, instead of saying, no, don't do that, right? Say, can you wait until your brain is fully, I want to say baked.
Right. Interesting word choice.
Wait until your brain is fully cooked and you're actually less likely to develop an addiction.
But that's 25, right? Ish.
Yeah, but it's not like it's, there's this huge thing between like 24 and 25, right? Like 25 is where we'd like to get to, but if we can get to like 19 instead of 14, that's huge. That's really huge. And one of the things that I struggle with parents, especially parents of my generation, so Gen X, right, is that oftentimes they will not recognize that their kid is really at risk now because these are not the same drugs, especially with marijuana. Yeah. This is just not the same thing, and I think parents, some parents, it's really important for them to feel like they're their kid's buddy and best friend and, and stuff like that. And what they need is a parent who loves them unconditionally.
Yeah.
Right. So being able to talk with parents saying, listen, when I was in med school, right, we thought that marijuana actually caused people who were going to be diagnosed anyway with schizophrenia. It just caused them to be diagnosed earlier. Right. This has changed.
Yeah.
If you look at the cannabis products out there, we are actually seeing, and I think it was in Denmark, there was a huge study that was published 5 to 7 years ago. And what it was showing is that there was an actual increase in the incidence of schizophrenia among younger people, right? So this risk paradigm is shifting. And I think parents really need to appreciate that. They also need to appreciate that, their kid may be struggling with more than just smoking pot. Their kid may be profoundly depressed. Their kid may be anxious. If you look at kind of the mental health overall for teenagers, it's really deteriorated over the past 5-10 years. Right? Kids need help and parents need help. But pretending that something doesn't exist or that, it's just like, when I was in high school and I was smoking pot, right? It's not.
Yeah.
That is not helpful.
Yeah. And also, I mean, even beyond that, I think just the experimentation that, is normal, I think was normal and probably will continue to be, the level of danger.
Yeah.
I not trying to make light of this, but I remember, being a teenager and like my parents and, society telling me that like, hey, be careful with what you do because you never know if it's like laced with something. And I would laugh it off and experiment all I wanted to. But now being that adult that's trying to communicate that same message to my children, like there's an actual risk that you can lose your life.
Yeah.
Oh yeah.
And I feel like that's something that's maybe always been there, but much more profound.
Yeah, it's much different.
Yeah.
And the emergency room visits have gone way up.
Yeah.
It's a different ball game, right? And I mean, I have a 22-year-old daughter, and I have to say there are lots of parenting challenges.
Yeah.
But being transparent really is important, and helping your kid to understand, just like with my clients, no matter what, I'm on your team. You can't get rid of me.
Right.
I'm going to be there cheering you on.
That's right.
And, there's a pothole right ahead. So what are we going to do about it? Not what I'm going to do about it, because I can't make choices for you. What are you going to do about it?
Right.
That's awesome. Well, thank you. This has been amazing. How do we find you?
So we have a website, Triangle Wellness and Recovery. It's actually easier to just do TWRNC for North Carolina, www.twrnc.com. My bio is up there. Our contact information is up there. And, I'm very quick to offer somebody like a 10-15-minute conversation. And maybe my practice isn't the right place for them, but maybe I can plant a seed. Right.
Love it.
It's huge.
Yeah. Cool. So I love talking with clients and their families and prospective clients. And also just, one of the things I really miss about academic medicine, there are many things I do not miss, by the way. But one of the things that I miss is really the teaching, right? The education.
Yeah.
So I try to do a lot of that.
Great. Well, y'all are doing great work. Please keep it up.
Absolutely.
We love working.
We appreciate you guys.
We do appreciate you guys.
Thank
you. Dr. Sara Koenig, thank you so much for being here today.
Thank you for having me.